Patil, consultant plastic and cosmetic surgeon, founder and director, Seraphic Aesthetics, Navi Mumbai. I'm practicing at Kokilaben Dhirubhai Ambani Hospital, Medical Hospital, and White Lotus Hospital, Navi Mumbai. Today we are going to talk about breast augmentation. So, what is breast augmentation surgery? What exactly is done during breast augmentation surgery? And who is the candidate for breast augmentation? If you are not happy with the shape and size of your breast, then you may opt for the breast augmentation. So what are the types of breast augmentation? Breast augmentation is done by three methods. First one is with implant. Usually the implant is a silicone implant. The second variant of the breast augmentation is the fat grafting, in which we take out the fat from the abdomen or medial thighs of the patient, and that is injected into the breast tissue. And the third variant of breast augmentation is hybrid breast augmentation, where we put an implant, and in addition to implant, even fat grafting is done. So coming to the breast augmentation with implant, the silicone implant previously used were with a liquid silicone. They had a tendency to break, and the silicone oil used to go into the breast tissue, and that was a drawback of those implants. But now the implant quality is improved. The coarse gel of the silicone implant is so sturdy that even a truck cannot break it. So what is the difference between the breast augmentation with implant and fat grafting? Which one is better for you? Implant is designed by a patient whose main concern is projection of the breast. In addition to the volumization of the breast, they need a projection. The implant is the best choice. But if your concern is not the projection, you just want some contour, some volumization, and you don't want any implant to be put in your body, then the fat grafting is an option. The only concern with the fat grafting is that it may require two sittings. That is, whatever fat we inject in the breast tissue, around 30 to 40% of that fat will be absorbed. So we might require a second sitting for the augmentation again. Coming to the breast implant. When we are doing a breast augmentation with implant, we are using an implant of silicone, that is with micro texture or smooth. Okay, so the silicone is very sturdy. So if you can notice, even I am twisting the implant with too much of pressure, it comes to normal. It doesn't break. Even I stab this implant with a knife, the gel is not going to come out. Okay, so these are sturdy implants. Today's implants are very sturdy and they don't break away as compared to the previous implants. The next question is asked about when the implant is placed in the body, whether a patient can breastfeed. Of course, you can breastfeed. The thing is that we place implant behind the breast tissue, so we are not touching your breast tissue at all. So lactation or imaging for your routine breast examination and all is going to be absolutely normal. Even the feel of the breast is not going to change because of the implant, as the implant is behind the tissue. So the feel of the natural breast is going to be there. Now coming to the breast augmentation with the fat grafting. The fat grafting will take excessive fat from the tummy area, lower abdomen or the medial thighs, and that will be injected into the breast tissue. So the difference between the implant and graft is that implant is behind the breast tissue and the fat is going to be injected in the breast tissue. Are there any side effects of the breast augmentation? No, there are no side effects of breast augmentation. Yeah, but in some of the patients, he may require to change the implant after an average period of 15 years. So what should we expect to be recovery from breast augmentation surgery? It's a one-day procedure. So patient gets admitted, we operate in the afternoon, and by evening or maximum next day we can discharge the patient. You will have to wear a facial garment for the proper positioning of the implant in the pockets, and that is to go on for next 2 to 3 weeks only. After that, you can continue with your sports bra or other bras. Scar placement in breast augmentation surgery is usually done in or placed in the inframammary fold, and it's well done. Cost of the breast augmentation surgery depends on two factors: hospital you are choosing and the implants you are choosing for the augmentation.